I'm really disappointed, I got to tell you, with pathologists over the years. I always thought pathologists would be the medical specialist that would take the mantle of responsibility and leadership as experts in this area of genomics and genetics. We know that there are genetic counselors. They are the subject matter experts of genetics and inherited syndromes and things like that. But we really didn't have that for genomics.
I share some of your feelings about pathology, actually. When I started medical school, I knew I wanted to do genetics, and I was thinking I wanted to do pediatrics and medical genetics. I was doing the combined MD PhD program at the University of Pittsburgh, planning my genetics PhD, did 2 years of medical school, started doing my genetics PhD training, and I ended up doing a rotation through medical genetics. And while I was there was a molecular pathologist rotating through the clinic that I was rotating through it. And I was like, what is this field that I've never heard of molecular pathology? Like, if I've heard of pathology and they thought of people looking through microscopes at tissue, I ended up peppering her the entire afternoon with questions about kind of what is this specialty that I've never heard about. So molecular pathology is a subspecialty of pathology that does exactly what you're talking about, exactly what you think pathologists should be doing, and focusing on genomics, focusing on molecular testing, on that diagnostic testing.
This is Genetics for Healthcare, a podcast for patients.
Hey guys, welcome to another episode of Genetics for Healthcare. This is a podcast dedicated to patients and their caregivers to help advocate for a precision medicine approach to their care. You can find us at geneticsforhealthcare.com. You can also follow us while you're on our website at any of those social media icons at the top of the page: Spotify, Apple Podcasts, YouTube, LinkedIn, Facebook, Instagram, and TikTok. While you're there, be sure to hit that subscribe button to get amazing updates on new episodes like this one. Today, we've got Dr. Brian Schertz, founder and president of connectmyvariant.org. He's also an associate professor of pathology, microbiology, and immunology at Vanderbilt University Medical Center. Dr. Schertz, thank you so much for joining us on the podcast.
My pleasure, Rome. It's good to be here.
So I read your background. You're a pathologist by training, but you also did a doctoral program in genetics as well. So I'm going to start this off. Hopefully this is not a sour note, Dr. Schertz, because I feel like this is a safe place to say this to you. I'm really disappointed, I got to tell you, with pathologists over the years. I always thought pathologists would be the medical specialist that would take the mantle of responsibility and leadership as experts in this area of genomics and genetics. We know that there are genetic counselors. They are the subject matter experts of genetics and inherited syndromes and things like that. But we really didn't have that for genomics, and we'll get into that a little bit in a minute. But forgive my sour mood here. But what drove you to study medical genetics, going into pathology?
That's a fascinating question, and I think that I share some of your feelings about pathology, actually. When I started medical school, I knew I wanted to do genetics, and I was thinking I wanted to do pediatrics and medical genetics. And I was doing the combined MD PhD program at the University of Pittsburgh, and I was planning my genetics PhD, did 2 years of medical school, started doing my genetics PhD training, and I ended up doing a rotation through medical genetics. And while I was there was a molecular pathologist rotating through the clinic that I was rotating through at that time. And I was like, what is this field that I've never heard of molecular pathology? Like, if I've heard of pathology and they thought of people looking through microscopes at tissue. And I ended up peppering her the entire afternoon with questions about kind of what is this specialty that I've never heard about. So molecular pathology is a subspecialty of pathology that does exactly what you're talking about, exactly what you think pathologists should be doing, and focusing on genomics, focusing on molecular testing, on that diagnostic testing. And so after that afternoon, I was like, this is what I've got to do. I love the diagnostics. I love the diagnostic technology. I love making genetic diagnostics more accessible to patients everywhere, making it more accurate, making it more understandable. And really, I saw molecular pathology as the field that could do that. And so I got into pathology. And then when I went through pathology residency, I was like, okay, how can I apply everything I'm learning to molecular diagnostics? And how can I get through this as quick as I can and learn as much as I can to learn about how all of this other diagnostic technology can be applied to molecular testing.
And you trained in the era where, I mean, just the explosion of growth around what we knew about, or what we thought we knew about the genome, evolved over time. And this is
Absolutely.
not to
And it's
date
still happening.
ourselves. Exactly. Exactly. Once you matriculated, to the University of Washington, I think that's, well, you correct me. Is that where you conceptualize the concept of Connect My Variant? Tell us about the organization and what was the inspiration for creating it.
Yeah, thank you. So when I finished residency training, my first job was at the University of Washington, and I was actually went through a period where I was kind of frustrated at what I was doing as a molecular pathologist. And the reason why was because when I was doing medical school training, when I was doing my PhD training, when I was doing my postdoctoral and residency training, then I learned that when we learn about these hereditary diseases like hereditary cancer caused by BRCA1 or BRCA2 mutations or Lynch syndrome, or any of these other hereditary diseases, that the reason why we're doing this diagnostic testing is because if somebody can find out about their genetic diagnosis before they get cancer or before they get heart disease, then oftentimes there's something they can do to prevent them. So if somebody has a BRCA1 mutation, for example, then they can get increased mammograms and breast MRIs, or they can get a mastectomy, or they can get their ovaries out when they're done having kids, and um, and that can sometimes prevent disease. In the case of Lynch syndrome, if a woman can have over 50% risk of endometrial cancer, done having kids, gets her uterus out, that decreases her chance of uterine cancer from 60% to zero. So there's these situations where you can get better treatment, you can optimize your healthcare, and that excited me. But when I came into the University of Washington, we started signing up this first next generation sequencing panel to test for many different genes that cause hereditary cancer risk, and developed by Mary Claire King and Colin Pritchard, my colleagues here. Just an amazing test, one of the first ones that came out, and 80% of the time we were testing people who already had cancer. And I was looking around, I was like, is this something unique here? And I looked around, we were actually doing pretty well compared to other places across the country. And I started thinking, why are we doing this the same way that we've already been doing it forever? And so then I started shifting my research interests into saying, well, how come we can't get more of the relatives tested after we diagnose somebody with hereditary cancer? They've already had cancer. They're going to get the most aggressive screening because they've already had cancer. But what about their kids, their siblings, their parents, their aunts, their uncles, their cousins? What about them? Why aren't they getting genetic testing? And can we get more of them in the door? And can we help them to get their diagnosis before they get cancer so they can prevent that?
See, that's awesome because so here in Genetics for Healthcare, as we were talking kind of before we we went live here, we really empower and try to give our viewers like the information, the resources to talk about it, and that's kind of one of the things that growing up, in many of the guests that I've talked to, cancer wasn't talked about, right? Even if you had a family history of it, it was kind of a hush hush. And even today, even though we know there's more access to information, there are, like as you said, screening to prevent this. It's really tough for people to talk about it, before disease happens. ConnectMyVariant.org. You guys deploy family outreach navigators to help that situation, to talk to someone that empowers them on how to talk about this. And you've developed evidence-based family connection protocols to help people identify other at-risk relatives and help those relatives to access genetic testing or genetic counseling at the least.
Yeah.
How can you share how your navigators connect with people? Like, how does someone come into your
Yeah.
website or into the knowledge of the services that you offer and get
Yeah.
them connected?
Yeah. So the service is designed for anyone who knows about hereditary cancer risk in their family. So that person who got diagnosed with cancer gets their genetic test, talks to their genetic counselor. Their genetic counselor says, "Go talk to your relatives," and they're like, "Okay, what do I do next?" That's where we pick up. It's also for people who know about hereditary cancer in their family. They know that the gene, the mutation in their family. They might not have tested positive, but they're still interested in helping people. It could be the spouse of somebody, could be the brother or sister who tests negative, and they also want to be able to help their relatives. And so the family outreach navigators and all the content on the website is designed so that somebody can have someone to go to and say, okay, what do I do next? Who do I talk to next? How do I talk to them? I feel awkward about talking to somebody about genetics. Can I role play with somebody? Can I figure out what scripts I can use to be able to talk to them better? Hopefully, that person will receive a family letter from their genetic counselor, and they might have already actually reached out to their family members. Their family members say, "Yeah, I'm not really interested," and they're like, "But I want to do something more. And how do I keep this conversation going? Because my family member isn't ready to get genetic testing now, but I know it's really important for them, and I know that down the line they're going to thank me if I can help them get genetic testing. And most of the time, those people are going to test negative, and they're going to be like, okay, it's not something you have to worry about. But when they test positive, that can be something that's life saving.
Yeah.
And so those family outreach navigators are there just to provide some support, to provide some ideas, and to help that person. And sometimes it takes one or two attempts. And so they're there over longitudinally, over 6 months or a year. Somebody can say this worked or didn't work, and they can come back to those family outreach navigators to help that. And then even better than family outreach navigators, for some of the variants, then we have somebody who actually has that mutation, who is what we call a variant champion. And then that person is going to be bringing that person in to talk to other people who have the same mutation, the same variant, and the same gene, and to help them share stories about how they work with that. And then there's something else we can do that's even different, that's beyond those family outreach navigators. You might have been about to ask about that, so should I let you ask the question first, or should I tell you the other cool thing we do?
No, by all means. So
Yeah.
I'll say this one once, and then I'll ask you more about that. So here's the reason why this is important, folks.
Yeah.
So there's someone out there who may know they have a pathogenic variant, a genetic variant that raises their risk of certain cancer or disease. It can be difficult sometimes to talk to your own family about it, right?
Mm-hmm.
Like, even scripture says a prophet is not heard in their own land. You may be too close to it.
Absolutely.
The point being, you guys did a pilot study on your methodology, on the service that you provide, and it showed while you were at the University of Washington in your study that Connect My Variants process was 25 to 50 times more effective than cancer prevention education that traditionally happens and the outreach interventions that happen with us just going to our doctors and having conversations, and then the expected outcome of us having conversations with everybody else to try to lead them to this information. Please tell us more about your effectiveness in this family outreach navigation.
Yeah. Well, there's two numbers on it. The 25 to 50% more effective is because if you see something on the bus that says "Go get a colonoscopy," right? That's going out to everyone, right? And if I go and get a colonoscopy today, my chance of getting colon cancer are actually pretty small, right? But if somebody who has hereditary cancer, the brother of somebody who has one of those pathogenic variants, if they see that sign that says "Go get a colonoscopy," they're going to be like, okay, they're going to think about it the same way I think about it. But if their brother tells them, hey, I have a pathogenic variant for Lynch syndrome, and you need to get genetic testing for this specific gene, then that person, that brother is like, oh, yeah, I have a 50% chance of having that. And that's why the message is more effective, is because the messages that are going out to the world are going out to people who have about 1% risk. But the message is going out to those siblings and aunts, uncles, and cousins going to people who have much higher risk. So that's where the 25 to 50% comes from. The other thing we do is when two people have the exact same mutation, then we introduce them to each other. And what we found there is that introducing to people who have the same mutation increases family outreach activities by 2.5-fold. So someone might, reach out to their person, once or twice, or do one or two things to try to find their family members. When they find someone else with their same mutation, then they 2.5 times more of that family outreach. So that's the other number that we found with our initial pilot study, is that we're targeting the message about prevention to the right people, and then also by helping people work together as a group, they don't feel so alone, and they learn ideas from other people, and they start to say, kind of, this is something I'm doing with somebody else as opposed to doing on my own, and that really helps people. That increases the family outreach by 2.5-fold.
That's super powerful. So you guys are creating community.
That's right. That's exactly right.
Does Connect My Variant also address other hereditary conditions outside of cancer?
Yes, we started out doing hereditary cancer because that's where we saw the most interest. But right now, we also have it's really, we're not about a specific disease. We're about that family outreach and forming that community within your own family. And so we also help people with hereditary cardiomyopathies, with hereditary hypercholesterolemia. So anything that is, I can state the technical terms, then I'll tell you the common autosomal dominant adult onset genetic disease. And so autosomal dominant means that there's one copy of the gene that can dramatically increase someone's risk, as opposed to needing one copy from each parent. And that means that brothers and sisters are going to have 50% chance. Children are going to have 50% chance. You probably hear it from one of your parents, which means your aunts and uncles have a 25% chance of having it. Your cousins have a 12% chance of having it. And so that's what autosomal dominant is. So when that happens, everyone in the family needs to know about it. And then adult onset, that means that this is something that's not something that you're going to see like totally obvious in kids. This is something that we're talking about risk of something happening when someone's an adult. And the reason why that's important is because we really only focus on things where there's prevention going on, where if somebody knows about it, then they can make a difference in their lives, a substantial difference in their life, in the way they're treated, in the way they talk to their doctors, and they can do something that's going to dramatically increase their health just because they know about it.
Yeah.
So what we found is more and more diseases, more people with diseases are like, oh, have you heard about my gene? And will it help with this? And we look at it and we're like, yeah, it would. This is the type of gene where, you're learning your disease happens as an adult, and all of your siblings and your parents and your cousins are going to need to know about this. Absolutely, we can help with outreach. So we keep on adding genes as we go along, as we find people who are thinking about this and are looking for resources for that help with family outreach and community building.
So that's tremendous because, see, you just mentioned most people find out that they have an inherited mutation only after they've been diagnosed with cancer or some other disease.
Yeah.
And the resources on your website are tremendous. Again, you help screen for and will help communicate, through community and through a family tree. You can help communicate with any disease, any type of, genetic variant that is inherited. But I learned of your website through a comic book.
Yeah.
Like just looking for resources. And it's a comic book that illustrates a woman whose sister received a cancer diagnosis, and that person received genetic testing. And it is a wonderful illustration of how real life, how we're affected by this, but by just having a little bit of knowledge and curiosity, and then connecting with resources like Connect My Variant, this could be a watershed moment in your family's history to prevent disease going forward.
Absolutely. And so Mark Hicks and Caitlin Schertz put together that. Mark Hicks did the illustration, and Caitlin Schertz put together the text for that. And it's a great illustration of what can happen. And it illustrates something that I think when people realize, it helps them think more about hereditary disease as something that's a community thing, not just an individual thing. And that's the principle. When two people have the exact same mutation, there's a 90% chance they have a common ancestor. And when we introduce people to each other with their permission, then that opens doors. They're like, oh, this is my second, third, fourth cousin. I'm not sure how. And that forms that connection. It's a unique connection. And it also, we help them with their genealogy. We help them find out how they're related to each other. And it doesn't happen very often, but occasionally they can actually find out who that common ancestor is. When that happens, they know which parents, which great grandparents, which great great grandparents sometimes have that mutation. They know which cousins and which second cousins are at risk and which cousins they don't have to talk to about. So it makes it a lot easier because there's a bunch of people you don't have to worry about. And then there's some people who you know that are actually at higher risk than you thought they were before. And so you know who to talk to. You have somebody else who can help you talk with them, and it can be really powerful. We talk about it like the snowball growing. And you find two people that connect with each other, and then sometimes maybe they're fourth or fifth cousins. Then we find someone else who has the same mutation, who's a third cousin of one of them. And then someone else who has a mutation who's a second of the other one. And immediately they get tied into that family tree, and immediately they know which of their grandparents, which of their great-grandparents had it. Sometimes it answers questions about their family history they didn't know about before. And always it helps them realize, oh, these are the cousins I need to talk to. These are the people who are at risk. And it can really magnify. Once we saw a genetic counselor in Ohio finding two people with Lynch syndrome who were third cousins, and they found over 40 people who have the same mutation just from connecting those two individuals.
That is freaking awesome.
It is. It really is.
Finding the people and being able to connect them is freaking awesome. Not necessarily the Lynch syndrome, but on your website, you've got other stories like that. Again, it's just really tremendous. Talking about the value of the work that you and your team do, because let's say like Lynch syndrome, some people have discovered this and turned this into a mission to educate and save family members. Right. So there's a couple of stories that are right on your website and of several different people who have engaged Connect My Variant. One is Nicole, a Latin female. Her father was diagnosed with colorectal cancer. A very astute clinician, mind you, suggested germline genetic testing. As a result, she found her father had a BRCA1 mutation. Mm-hmm. And through working with you, you guys were able to trace that this variant came directly out of Mexico. Okay. Yeah. Again, like being able to trace your lineage. There's another one, a woman by the name of Joanne. Her grandfather had died of colorectal cancer in his 30s. Her father diagnosed with colorectal cancer in his 40s. His 4 siblings had cancer. And, even though, again, this is kind of like that background where, people, are affected by disease, but how well is it talked about, right?
Yeah.
But working with your genetic counselors, they helped her piece together her family tree and her journey to find her family members who originated in Trinidad and Tobago. And because everybody, matriculated from there and got remarried, they were just spread out all over the place.
Yeah.
But they were able to connect her with a fourth cousin who was in the midst of his battle with cancer and tested positive for Lynch syndrome, which she did as well.
Yeah.
How important is it to work with a genetic counselor to build that family tree? And how can that knowledge transform cancer prevention as we know it?
Yeah. So what you said, it actually highlights one of the real challenges in the healthcare system in the United States today. At Connect My Variant, we don't have any genetic counselors. These are all the family outreach navigators are volunteers, mostly undergraduate students who are interested in genetic counseling who want to get some experience there. The genetic counselors in the United States now aren't paid to help people with their family outreach. A lot of them do it because they're passionate about it. But oftentimes they only have the ability to help someone have the resources they need in that one genetic counseling return of results that they have. And so it is super important for someone to be able to build their family tree, to be able to try to figure out where their variant came from, to try to reach out to their relatives, try to find other people who may be able to help them with that. But those resources really aren't part of the standard healthcare system here in the United States. And that's the hole that Connect My Variant is trying to fill. There are other countries that sometimes are a little bit better. Australia is quite a bit better at having genetic counselors really be able to be involved in that family outreach piece, for example. And so that's what we're really trying to do. And sometimes you have a hard time reaching out to family members, and sometimes there are people who are super, super passionate about cancer prevention, but need a little bit of push to talk to their family members. And actually, the story that's on the website that's my favorite there is with Matthew Knowles. Matthew Knowles, we had the benefit of being able to talk to early on, and he has a BRCA2 pathogenic variant, had breast cancer, chest cancer. He likes to say because men don't have breasts, right? Men have chests. So he had chest cancer and became a really wonderful advocate for cancer prevention in men. And his kids, Beyonce and Rihanna, don't have the BRCA2 variant. Um, and he made sure he took care of his kids. But when he connected with Connect My Variant, then we started helping with his family history. And he was like, oh, yeah, I need to talk to all of these cousins now that I haven't talked to before. We never found out which side of the family the variant came from. Um, but he started reaching out to cousins he hadn't reached out to before to say, hey, you need to get genetic testing. And, because I have this, you have a chance of having it, and genetic testing is not too expensive, and I can help you find a way to get it. He knew he didn't need a family or genetic. He knew what he was doing, and he was really passionate about doing that. But it was interesting to me to see how at first he was telling the world about this to help everyone with prevention, but he hadn't gone back to his cousins to talk to them yet. And working with Connect My Variant helped him do some of his family history, find out the people he needed to talk to, and reach out to his cousins so they could get genetic testing as well.
As he mentioned, I don't want to step on that. So as Dr. Schurz just mentioned, that's Matthew Knowles of Beyonce Knowles fame. That's her
right.
dad, Beyonce, and Jay-Z, Beyonce, that one. Yes.
That one. Yeah.
Male breast cancer survivor, chest cancer survivor, and BRCA2 carrier, has worked with Connect My Variant. You just mentioned something, because it can be difficult to trace your family history. And I can imagine in some cases, disease can skip a generation. Let's say someone's in that situation where, well, my grandmother was, but my uncles, my mother, those things, and they have a suspicion. Should they be tested? Can those people also trace genetic variants in their lineage by connecting to your group?
Yeah, absolutely. And this is one of the things that family outreach navigators can help with is help figure out which side of the family should get tested, which side of the family maybe is lower risk. We've seen surprises. Sometimes someone will say, "Oh yeah, my grandmother had breast cancer, so I'm sure it's coming from that side of the family." And it turns out it's not. It turns out that it's coming from the dad's side of the family, and I didn't get breast cancer because men don't get breast cancer as often. And so we've seen a few surprises, and the family outreach navigators are trained to help somebody to go after the most likely people, but not forget the people who still have a risk, but might not be the most likely candidates. And so we think about those things. We can walk through those things, and we can help people find who to think about first and who to think about after that.
For some people who have concerns around privacy, because they have taken a 23andMe, and 23andMe filed for bankruptcy, and there's a huge public concern around safety. And you mentioned, a lot of times there's secrecy or just situations where someone may not want you to know, or they may not want to know. How does your team balance the privacy concerns with the urgency of notifying at-risk relatives who may be unaware of their genetic risk?
Yeah. So we help people talk to their own family members. We're not the people who are talking to people. And part of that's because research has shown that's the best way to do it. So we take the minimal amount of information we need. And when somebody signs up, then there's a box to say, I'm interested in sharing my contact information with other people who have my mutation. And that's all we share. We're sharing first name and email. And with other people, only with other people who have the same mutation in their family. And when people are sharing information, we encourage them to share information really on their own terms. and in their own private accounts. And so, they could be, emailing each other back and forth. Some people set up Facebook groups because they feel comfortable with Facebook, but other people don't because they don't want to have that there. And so we're not being the central source for all of the information. We are enabling variant champions and families and these communities who have those specific pathogens to talk with each other, to work with each other. And so we want people to, one of the reasons why it's better for somebody to talk to their own family than it is for us to do that separately is because they know their family members. They know their culture. They know each individual person and how they should talk to them and who they should talk to. One of the surprising things, you talked about this earlier, that sometimes it's hard for people to talk to their immediate relatives because there's baggage, but it's actually easier for them to talk to their cousins or their second cousins. If they're related, they can say, "Oh yeah, great grandma Bessie. Great grandma Bessie." And, "Oh yeah, we know great grandma Bessie." And that may be the only connection they have is like knowing who their great grandmother is. And then it's a little easier for people to talk to them because they have that connection, but they don't have any baggage. And so it's been fascinating to see how sometimes with immediate family members it's hard. Just with cousins, it's a little bit easier, and which is great. We want people to be doing both, talking to their immediate family members and knowing which cousins to talk to and feeling comfortable talking to them. And that can make actually somebody who you just saw once at a funeral turn into somebody who actually turns out to be a really good friend, which is the one of the most surprising and pleasant things I've seen about Connect My Variant. Is people who didn't know each other find out they have the same mutation and start to be great friends and the great support network for each other.
One of the challenges, and we were talking about kind of like our histories in this space of genetics and genomics, and one of the challenges early on that we were asking, even though the technology was version 1, is how do you identify those most likely who need to be tested? This is kind of before there were guidelines. BRCA was there, but then there were formal guidelines. Then came reimbursement. Of course, reimbursement always comes after. But you said it, even when you were standing up this organization, your observations were like 80% of the people being tested for a hereditary cancer, variant already had cancer. How can we improve that? Like nowadays, when there's like workflow solutions, there's better technology. We have AI and any number of things that are going to come accessible on our phones, but we're still asking the same question. How do we identify these patients? How do we become more proactive in our consultations, in our healthcare, in our screening to get these patients before they're affected? What do you think needs to be addressed in order to do that?
Yeah. Well, I've seen two solutions proposed, and the solution I think is most popular now is just testing everyone. Just do testing for everyone. And when I was at the University of Washington about 3 or 4 years ago, we did a pilot study looking at what it would look like if we said we're going to give free testing to everyone. We're going to specifically reach out to people who are underrepresented genetic testing. And so we invited about 40,000 people to get tested. About 2,500 people actually got genetic testing, and about 1.5% of them got new diagnosis, which is what there's other studies who've seen the same thing. But what we saw was that it was still a heavy lift, and not very many people wanted to get genetic testing, even if it was free. And that the people who were least likely to get genetic testing were people who were from groups that were most likely to have mistrust of the healthcare system because of historic inequalities and historic prejudice. And so I don't think it's a silver bullet. And the other solution is to really expand the family outreach resources that are available. And that's something that's dozens and dozens of studies have shown is the most cost-effective way to prevent cancer and to do that family outreach. And so that's why Connect My Variant's where it is because all of the data shows it's the way to do it. And my personal experience has also shown that this is the way that you can break down barriers, and both mental barriers and financial barriers, This is the way to be able to communicate effectively with people who have some distrust of the healthcare system, is when they have a cousin telling them, this is important to do and it helped me. And so I think that the reasons why that family outreach is so important and that community support is so important is because that's how we change the world. It's so rare that the world changes because some top-down thing saying this is what needs to be done. It happens family by family, community by community, people talking to each other and saying this will work for me.
Very well said.
Yeah.
Well, we'll get you out on here on this, Dr. Schertz. On Genetics for Healthcare, we always like to give our listeners, our viewers, practical action items. Mm-hmm. The information is good, but we want them to carry forward with language, with confidence, to have these conversations with their care providers and, of course, their family members. And I don't know how many people you got, but there's a big gap for Connect My Variant to cover with the things that we've been talking about. But for those who may be watching and suspect that they have a genetic risk, but feel overwhelmed, right?
Yeah.
Can you give them 3 practical tips to take action and to take control of their health?
Yeah. So if you have a family history of cancer and you feel like you want to get genetic testing, just talk to your doctor. Next time you see your doctor, talk to your doctor. If you feel like you don't want to wait to talk to your doctor, see if you can find a genetic counselor. The National Society of Genetic Counselors website has a kind of find a genetic counselor near you. Genetic counselors are experts, know more than your primary care doctor about genetic testing, and it can help you get genetic testing. So if you think you have family history and don't know about your genetic status, then that's what to do. If you know about something genetic in your family and don't have genetic testing yet, it's even more important to talk to the person who has a genetic result, get a copy of their report, go to your doctor, get a genetic test. And if you know what your diagnosis is and know that there's a genetic diagnosis in your family, sign up for Connect My Variant, and we can help you do more outreach than you've already done. No matter how much that is. If you need help talking to your siblings and kids, we can help with that. If you feel like you've already talked to everyone, then we can help you find someone else to talk to. Because I've never seen anybody who's talked to all of their relatives.
Yeah. Dr. Brian Schertz, founder and president of ConnectMyVariant.org. Very, very valuable service. And thank you, Dr. Schertz, for helping us, find the words to communicate not only with our care providers, but most importantly, with our family members.
Thank you, Rome. It's been a pleasure to be here.
You bet.